In the past 50 years, immunizations have saved more lives than any other health intervention. Vaccine-preventable diseases have declined significantly in countries with successful immunization programs. Where immunization rates are high, disease rates are low. It's because of Canada's successful vaccination rates that we rarely see diseases like polio or diphtheria, which used to severely debilitate or claim the lives of thousands of people every year. Immunizations are important throughout a person's life. To start at the beginning, we chat with public health nurse Jessica Madrid about infant immunizations.
Vaccination or immunization is the best way to protect your children against many serious diseases. Thanks to immunization, many of these diseases are not common in Canada, but they still exist in many other countries of the world. In order to protect your child from these diseases as early and effectively as possible, it's important to get your child's vaccines done on time. In BC, the primary immunizations are given to children at 2, 4, 6, 12, and 18 months of age. The primary schedule protects children against tetanus, diphtheria, polio, pertussis or whooping cough, hepatitis B, Haemophilus influenza type B, meningococcal and pneumococcal bacterial infections, measles, mumps, rubella, and chickenpox or varicella disease. Childhood immunizations are given by a public health nurse at our local health units. To book an appointment, please call 565-7381.
The school immunization program starts in grade kindergarten. In grade kindergarten, we offer a booster dose of diphtheria, tetanus, pertussis, and polio. The vaccine is offered at the health unit during the kindergarten health day circuit, which we hold in January. For any students who miss the kindergarten health day circuit, they can call the health unit at 565-7477 to book an appointment in with the school and youth nurse. So in grade 6, students are eligible for vaccinations against hepatitis B, meningococcal, chickenpox, or varicella if they haven't had the disease after age 1 or they haven't been previously vaccinated, as well as the HPV vaccine for girls, which provides protection against the human papillomavirus. In grade 9, students receive a booster dose for tetanus, diphtheria, and pertussis, as well as the HPV vaccine for the human papillomavirus. So the school nurses send home consent forms to the grade 6 and the grade 9 students. This year we're going to try to get those consent forms out to the grade 5 and the grade 8 students to bring home to their parents. There's written information on there and a consent form to be signed. Once the consent forms are returned to the health unit, the school nurses go into the schools 3 times a year for grade 6 and 3 times for grade 9 in order to complete the series of vaccinations. For any students who are absent on those days, they can call the health unit as well at 565-7477 to book an appointment with the school and youth nurse.
Okay. Preventing infection through immunization is a lifelong process. Some vaccines are required by all adults, while others need to be tailored individually to you based on risk resulting from occupation, illness, lifestyle, age, as well as travel. For travel immunizations, please contact your travel health clinic or your family doctor at least 6 to 8 weeks before your trip. These vaccines are based on where you are going and how long you intend to be there. All adults require tetanus and diphtheria boosters every 10 years. Some adults may require a second booster of measles, mumps, and rubella depending on their immunization history. Adults with conditions that affect their immune system, such as transplant patients, those with hepatitis or kidney disease, may also want to consider immunizations. People over the age of 65 or those with chronic medical conditions should receive an influenza vaccine every year in the fall. Those people may also be eligible for a pneumococcal vaccine. The Northern Interior Health Unit has an adult booster clinic that is held Wednesdays in the afternoons. Please call 565-7381 to book an appointment or to check on your immunization status.
Northern Health's Preventive Public Health Department recommends vaccinating on time and according to the recommended schedule. For more information, contact your local public health unit, school nurse, or check out Northern Health's webpage at www.northernhealth.ca. Another excellent site for more detailed information on vaccines is www.immunizebc.ca. For Northern Health Highlights, I'm Erin Collins.